Namaste. I am Dr. Raghuram, consultant orthopedic surgeon. Deepavali festival where all elders and younger ones come together and celebrate. On these days, sometimes we face unforeseen situations like burning our hands and feet. What do we do when we come across these situations? Let's know from the experts. Dr. Shalini is here explaining more about this.
I'm Dr. Shalini. I'm a consultant plastic surgeon working at Viswanadha Hospital at Rajahmundry.
How many types of burns are there and what is burns?
Burns is basically injury to the skin. So it can be, most commonly we encounter thermal burns or heat burns. It can also be due to electricity. It can be due to chemicals like strong acids or alkalis. It can be post radiation. So how many types of burns? Thermal burns, depending upon the mode of injury. You have scalp burns, which is because of hot liquids. Contact burns, when your body hand comes in contact with a hot object. You have flame burns when the patient is in the fire accident. And flash burns when there is an explosion somewhere else and it is a flash of fire that patient encounters.
Is the material causing burns important? Is there a difference between oil and water?
Yes. Oil, being a more viscous fluid, tends to stay in contact with the body more, causing more burns injury, causing deeper burns injury.
What is degree of burns?
The degree of burns is the depth of the burns on the skin. So there are usually 4 degrees. First degree is the most superficial, which usually heals within 3 days. And as you go down, the 3rd and 4th degree is deeper burns, which most commonly will require surgical intervention.
Is the area of burns important?
Yes, definitely, because more than 20% of total body surface area requires hospitalization. In case of children or elderly patient, 10% or above requires hospitalization.
How can we be safe this Diwali?
So the most commonly affected is the pediatric age group. So kindly do not leave your children unsupervised with firecrackers. And always do not leave the firecrackers in the open and keep them away from fire. It's very important the type of clothes that you wear. Avoid silk clothes. Please wear cotton or cotton-based material clothes while bursting firecrackers. And next, most importantly, do not try to do any stunts while lighting firecrackers. Please follow the safety regulations. For example, don't light the fire bomb in your hand and then try to dispose, because you never know, any kind of mishap can happen.
What can you do when you have burns at home?
First and foremost, it's important to turn off the fire. Many people hesitate in using water, but the most important way to turn off fire is to use water. Please pour ample amount of water to turn off the fire immediately. Once the fire is out, then you can see what is the extent of the burns. You can apply any antibiotic cream like neomycin and then immediately bring the patient to a nearby hospital to assess the damage.
Is there something when should we visit to madam? Is there something like a golden?
I would recommend you to come to the hospital immediately, because only a plastic surgeon or a surgeon trained in burns treatment can assess the depth of the wound, the total body surface area involved, and can help you guide regarding further treatment. Most often, burns do not require surgical treatment. But having said that, all burns cannot be treated by conservative management alone.
Madam, patient is down. Can we treat the patient at home?
Yes, patient can be treated on OP basis, like I said, if the percentage is a very small percentage, but this has to be assessed initially by a surgeon, and then treatment can be continued at home. I wish you all a very happy and a safe Diwali this year.